Is acne plaguing your complexion? Those persistent breakouts keeping you from looking your best? What if we told you there's a revolutionary new way to treat acne without harsh chemicals or medications? Introducing blue light therapy, the innovative acne solution that harnesses the power of light to clear up those pesky pimples. Blue light therapy uses specific wavelengths of light that have been clinically proven to kill acne-causing bacteria deep within the skin. The light targets porphyrins, which are compounds inside acne bacteria. When activated by blue light, the porphyrins destroy the bacteria from the inside out. This means less inflamed breakouts, less redness, and more clear, glowing skin. The best part? Blue light therapy is completely safe, painless and chemical-free. Just a few quick sessions per week can drastically improve the appearance of your skin. With blue light therapy, you can finally say goodbye to stubborn acne and hello to a radiant, healthy complexion. The latest technological advancements have made these treatments more affordable and accessible than ever before. In this video, we'll dive into everything you need to know about using blue light as an effective acne treatment. You'll learn how the technology works, what results you can expect to see, and where to find the best blue light therapy options for your skin. If you're ready to uncover the cleansing power of light and achieve the clear skin of your dreams, keep watching. You don't want to miss these revolutionary acne-fighting secrets. Acne is one of the most prevalent skin conditions worldwide, affecting around 85% of people in their teens and young adulthood. Dermatologists have turned to blue light therapy as an innovative way to combat acne by targeting and destroying this pesky bacteria. This video will also explore how blue light destroys acne-causing bacteria, review clinical research on its effectiveness, provide tips for at-home use, and share the top devices available. Blue light therapy, sometimes called photodynamic therapy, PDT, is a form of phototherapy that uses visible light to treat various skin conditions. Let's see how the blue light kills the bacteria. P. acnes bacteria produce porphyrins as part of their normal metabolism. When porphyrins absorb blue light, they act as photosensitizers, creating free radicals and single oxygen molecules that are toxic to the bacteria. This photodynamic reaction ultimately kills the P. acnes through phototoxicity. Here are some of the clinical evidences. In a 2002 split-face study on 22 patients, blue light therapy for acne reduced inflammatory acne by approximately 76% on the treated side of the face after 3 weeks. A 2003 study on 13 patients found that 3 sessions of blue light combined with topical 5-ALA over 4 weeks reduced inflammatory acne lesions by about 58%. A 2007 study looked at combining blue light with red light therapy over 4 weeks. The integrated light treatment decreased inflammatory lesions by 67% compared to only 18% clearance in the control group. A 2010 randomized controlled trial compared aminolevulinic acid blue light therapy, ALA-BL, to 5% benzoyl peroxide in 169 patients. After 12 weeks, ALA-BL reduced inflammatory lesions by 50%, while benzoyl peroxide reduced them by 53%. A 2014 randomized controlled study in Singapore examined the results of 20 ALA-PDT sessions over 16 weeks. On average, inflammatory acne lesions were reduced by about 79% on the whole face with minimal side effects. A 2019 literature review evaluated 13 clinical studies on various light therapies for acne. The analysis concluded blue light showed a moderate efficacy in inflammatory acne lesion count reduction, compared to other light devices. These evidence suggests that incorporating blue light into a comprehensive acne regimen may benefit some individuals. The majority of clinical studies have examined in-office professional blue light therapy administered by a licensed provider. However, at-home blue light devices have become popular and offer a convenient alternative. Multiple clinical studies have found blue light therapy for acne very well tolerated with minimal risks or adverse effects. The most commonly reported side effects include 1. Mild stinging. 2. Temporary redness. 3. Mild peeling. 4. Temporary hyperpigmentation. 5. Photosensitivity reactions. Most dermatologists consider blue light therapy safer than oral or topical acne medications. If you and your dermatologist decide at home blue light therapy is worth trying, here are some tips for safe and effective use. 1. Choose a suitable FDA-approved device. 2. Start slowly. 3. Gradually increase usage. 4. Cleanse and prep the skin properly. 5. Target acne-prone zones. 6. Move the device around continuously. 7. Use light pressure and correct form. 8. Follow with acne-fighting and skin-soothing products. 9. Always wear sunscreen daily when undergoing light therapy. 10. Stick to schedule and maintenance. It takes 4 to 8 weeks to see initial results. Be patient. Blue light therapy reduces acne slowly and modestly. Choosing a suitable device is critical if you've decided to incorporate blue light into your acne treatment plan. Let us introduce first, Luster Clearskin Revive LED mask. Price range is around $199. Offers blue and red LED lights. Allow auto and manual settings. Covers full face. Most important is FDA cleared. Hydra Skincare PDT LED light. Price range, $250. Offers blue, red and yellow LED lights. Allow auto and manual settings. Cover full face. Trophy Skin Blue MD. Price range, $299. Offer blue and red LED lights. Separate panels. Allow auto and manual settings. Cover full face. Foreo Espada Blue Light Acne Device. Price range, $279. Offer only blue LED light. Cordless, waterproof, rechargeable. 2 minutes treatments. In conclusion, while still an emerging skincare technology, clinical evidence indicates blue light therapy has potential in the battle against troublesome acne. Keep in mind each acne sufferer is different. Blue light therapy seems most beneficial for inflammatory papular and pustular acne and works best alongside traditional treatments. However, research suggests blue light is a generally safe, non-invasive approach that may enhance progress when combined with proper skincare, medications, and lifestyle adjustments. Always consult your dermatologist to devise an individualized acne plan. For more details with this study, please visit us at spavalus.com. If you liked this video, please give us a thumbs up. See you next time.